everyone, welcome back to my YouTube channel. I'm Dr. Lila Abbate and I'm a physical therapist. So today we're talking about the condition pudendal neuralgia. So a lot of times you're complaining of butt pain, rectal pain, burning, itching. You can have penile shaft symptoms, you can have vaginal pain, urinary urgency frequency. There's a ton of array of symptoms that line themselves up with pudendal neuralgia. However, once you start getting into the nitty-gritty of the condition, having pure entrapment is somewhat rare. There has to be a big mechanism of injury and or your nerves are somewhat, not an anomaly, but to create so much compression in that area there has to be a huge causation. So I took a pelvic model and I tried to then tape where I would think that the ligaments would be coming through, just to show you two spots of potential compression. So here's our pelvis. We have ilia that come together and form the pubic symphysis. Then we have the posterior portion. This is the top is called the iliac portion. This is the ischial portion and the ischial tuberosities. So these are our sit bones. This is what we're sitting on. And then this little bone in here is called the ischial spine. So we're palpating and touching this inside the pelvis. So we're not palpating that from the outside. Here is the coccyx, and the nerves can traverse outside, somewhat compression coming this way, and then there's the perineal branch that comes into the perineal area. Then there's the inferior rectal branch that goes along the rectal opening, and then there's the dorsal branch that comes in underneath from this portion here, and then will either give maybe potential clitoral pain or external vulvar pain, and for a man, penile shaft or penile pain in general. So these are ligaments that crisscross each other. So this is sacrospinous, this one's sacrotuberous. So where the ligaments will intersect can be areas of potential compression. So entrapment is like really where they're bound down, the nerve can't move, and then we just have plain old compression, which is better to treat. So these ligaments are where they crisscross and they create an angulation that would potentially create compression. And the nerve will travel here in between and potentially create compression. As a physical therapist, we're looking at what seems to be the problem. Is it the muscles compressing the nerve? Is it bony position that's creating some type of tension on the nerve? And we're doing an orthopedic view. So we're looking at you externally to assess your sacrum, your coccyx position, how your ilias move in relation to the muscles and the muscle function, as well as the tractioning of the nerve or compression of the nerve. So that's just a physical therapy viewpoint on how we are assessing and what we're looking for with pudendal neuralgia patients. And I just wanted to share that with you. Thanks for stopping by.